Welcome back to Significant Talks, everyone. We're doing a deep dive today into the world of study designs in health research.
Exciting stuff.
Yeah, and we're drawing from a really cool lecture on the subject. It's from Dr. Hamdi's course. What was it called?
Modern medical statistics.
Yes, Modern Medical Statistics. A great course for anyone who's ever wondered, how do we actually figure things out in health? How do we know what we know?
And it really is like a superpower, understanding these different study designs, because it helps you cut through all that noise and all the health information, all the claims out there, and it helps you critically evaluate what you're seeing.
Exactly. So think of this episode as your training montage. We're going to be covering a whole bunch of different study designs, and we'll start with what are called observational studies. So these are studies where, researchers are like observers. They're watching and learning without actually interfering or changing anything.
Right. Kind of like a nature documentary, but for health.
I love that analogy.
So one of the simplest observational studies is called a case report.
Okay.
And this is where a researcher documents a unique medical event. It's like a little medical mystery, A doctor spots something unusual in their practice, and they're like, hold on, this is really interesting. I need to write this up.
Oh, I can imagine some of those case reports being real game changers.
Oh, absolutely.
Like, I'm trying to remember, I think I read a case report once that ended up leading to the discovery of a new link between a medication and a really rare side effect.
Yeah.
And that completely changed how doctors prescribe that medication from that point on.
Totally. That one case report can be that first domino that sets off a whole cascade of research and new understanding.
Right.
So to broaden the picture a bit, we often go from a single case to a case series.
Okay, so instead of just one patient, we're looking at a group of patients with similar diagnoses or experiences.
Exactly. So imagine you're trying to understand a very rare disorder. A case series allows researchers to combine the information from multiple cases, and that's often where patterns start to emerge that might not be obvious from just a single case.
That makes sense.
And it can be really valuable, especially when we're dealing with new or poorly understood conditions.
But you can't just jump from a few cases, right?
Yeah.
Be like, okay, we figured this out. This is how it is for everyone.
You're absolutely right. A case series can point us in the right direction, but it doesn't tell us for sure about cause and effect,
Right.
or how common this issue actually is in the general population. For that, we need to step up our game to a cross-sectional study.
Okay, so what's a cross-sectional study?
So it's like taking a snapshot of a population's health at a specific moment in time.
Oh, okay. So is that kind of like a large-scale survey?
Mm-hmm.
Where they ask people about their health habits and if they have any existing conditions?
Yeah, exactly. It gives us a glimpse into how common certain risk factors and diseases are, and it can also hint at potential links between those risk factors and those diseases.
But here's where things get a little tricky, right? Just because two things show up together in that snapshot, in that cross-sectional study, it doesn't necessarily mean that one caused the other.
You're spot on. That is the classic correlation versus causation dilemma. So cross-sectional studies are really great for raising questions, pointing towards potential relationships, but they just can't prove that one thing actually leads to another.
Gotcha. So if we're looking to really dig deeper into that cause and effect, like, where do we go from there? What's the next step?
That's where case control studies come in.
Okay.
And they're kind of like a rewind button for research.
Ooh.
We start with people who already have a certain disease, and then we look back in time to see if they were more likely to have been exposed to a specific risk factor compared to people who don't have the disease.
Okay. So if we were studying something like heart disease, for example, we might compare the diets, right, of people with heart disease to the diets of people without heart disease. Right.
And we might look for any differences. Like, were the people with heart disease eating more saturated fat or, had higher cholesterol levels in the past?
Exactly. And case control studies are particularly useful for uncommon diseases, where it would be really impractical to follow thousands and thousands of people to see who develops the disease.
That makes sense, yeah.
That could take forever.
Yeah.
But it's like being a health detective, piecing together clues from the past. But even with this approach, there are still some limitations.
I bet, yeah.
For one, relying on people's memories of their past habits, that can be a little iffy.
Yeah, I can imagine.
Right. People might not remember their diets perfectly, for example, or how much they exercised 10 years ago.
Right, yeah.
Yeah.
Those memories, they can get a little clouded over time. So if we need an even stronger study design, right, to really nail down that cause and effect over time, what's the next move?
Then we step up to a cohort study.
Okay.
And this is where we follow a group of people over time. Some of them might be exposed to a certain factor and others not. And we just see who develops the disease over time.
Got it. So instead of looking back in time, like in the case control study, we're looking forward
Right.
and actually tracking people's health as it unfolds.
Exactly. A classic example is the Framingham Heart Study, which has been following thousands of residents in Framingham, Massachusetts for decades. And it's given us some amazing insights into risk factors for heart disease, like smoking, high blood pressure, and cholesterol levels.
Oh, wow. It's incredible to think about how much valuable data we can get, right, just from observing and tracking people's health over time. But those long-term studies, I bet they're really challenging to conduct.
They are. You need a lot of time, a lot of resources,
Yeah.
and a lot of commitment, not just from the researchers, but from the participants as well. But the insights they provide can be absolutely invaluable for understanding really complex health issues and developing good prevention strategies.
This is already so illuminating. I feel like we've covered a lot of ground just now with these observational studies, but
Yeah.
I'm curious about like the other side of the coin, right? We've been talking about observing, but what about intervening?
Excellent point. That's where interventional studies come in,
Okay.
and especially randomized controlled trials, which are kind of the gold standard.
Right. I've heard so much about randomized controlled trials, or RCTs as they're often called. They do seem to be like the gold standard for evaluating new treatments, new therapies. What makes them so special?
Well, imagine you are trying to test a brand new drug,
Okay.
say for migraines.
Okay.
You could just give it to a group of people with migraines and see what happens.
Okay.
But there's a problem with that.
I'm going to guess. It wouldn't be very scientific, would it?
Exactly. You wouldn't actually know if any improvement they experienced was due to the drug itself,
Hmm.
or if it was just random chance, or maybe even just the placebo effect, or some other factor you haven't even thought about.
Right, right. So these RCTs, right, they come in to add that scientific rigor.
You got it. And the randomized part of the name, that's really key here.
Okay.
We randomly assign participants to either receive the new drug or a placebo. It's kind of like flipping a coin to decide who gets what.
So that randomness helps ensure that the two groups, the group getting the drug and the group getting the placebo, that they're actually comparable.
Exactly. It spreads those individual differences out evenly, minimizing the chance that one group just happens to be predisposed to do better from the start. It's like shuffling a deck of cards, to make sure everyone has a fair chance.
Right, right. I get that analogy.
Yeah.
But what about, people's expectations? Couldn't that still, influence the results?
That's a great point.
If people know they're getting the new drug, they might be more likely to say that they're feeling better, even if they aren't really.
Absolutely. And that's where blinding comes in.
Okay.
So ideally, in a double-blind study, neither the participants nor the researchers, nobody knows who is actually getting the real treatment and who's getting the placebo. And that's not revealed until the very end of the study.
So it's like a double layer of protection against bias.
Exactly. It helps ensure that any differences in outcomes that we observe, they're truly due to the treatment and not just because of somebody's expectations or preconceived notions about what's going to happen.
Wow. This is starting to feel like a real scientific detective story.
I know, right?
We're controlling for all these variables, eliminating bias. Pretty impressive.
It is. And when they are done well, RCTs are incredibly powerful tools.
Yeah.
They give us the most reliable evidence about whether a treatment truly works or not.
But I mean, even the gold standard, I imagine, must have some limitations, right?
Of course, nothing's perfect. One big challenge with RCTs is that they can be very expensive.
Yeah, I bet.
And time-consuming. You need a lot of participants, you need to follow them for a certain amount of time, and all of that requires resources.
Definitely. And what about ethical considerations? Are there ever situations where it might actually be unethical to conduct an RCT?
Absolutely. For example, if there's already a proven effective treatment for a serious condition, it wouldn't be ethical to withhold that treatment from some participants by giving them a placebo.
Right. It's about finding that balance, right? Between advancing scientific knowledge, but also protecting the well-being of all those participants in the study.
Exactly. And sometimes it's just not practical to do an RCT.
Okay.
For instance, if you're studying the effects of long-term exposure to something like air pollution, you can't really randomly assign people to live in polluted or non-polluted areas. That would be crazy.
Yeah. You can't control where people live. So it sounds like it's not a one-size-fits-all approach with these study designs. There are situations where other designs might be more appropriate or even necessary.
Precisely. Each design has its own strengths and weaknesses.
Right.
And researchers need to carefully consider which design is the best fit for their specific research question and the context of their study.
This has already been so insightful. We've covered a lot of ground with these observational studies, and now we've just scratched the surface of interventional studies. But you know what? I think it's worth highlighting that each of these study designs, they have their own place, right? In the world of health research.
Absolutely.
It's not about, like, one design being better than the other. It's about choosing the right tool for the job.
Couldn't agree more. Each design has its strengths and limitations, and understanding those differences is key to interpreting research findings correctly and making informed decisions about our health.
Couldn't have said it better myself.
So I think we left off talking about these randomized controlled trials.
Yeah, those RCTs, they just seem so important.
They really are. They're like kind of the foundation for evidence-based medicine.
Exactly. So can we unpack them a little bit? What makes them so special? Like, how do they actually work?
Yeah, let's break it down. So imagine you're trying to test a new drug. Say, oh, I don't know, for migraines. You could just give it to a bunch of people and see what happens.
Right.
But there's a problem with that approach.
I'm going to guess it's not very scientific.
Exactly. You wouldn't know if any improvement was due to the drug itself, or maybe just random chance, the placebo effect, or even other factors that you haven't even considered.
Right. It's like too many things could be going on. You can't really tease it apart.
Exactly. So that's where RCTs come in. They add that scientific rigor.
Okay, I'm intrigued. Tell me more.
So the randomized part is key. We randomly assign participants to either receive the new drug or a placebo. And it's literally like flipping a coin to decide who gets what.
Huh. So that randomness, that helps ensure that the two groups, the group getting the drug and the group getting the placebo, are actually comparable, right?
Exactly. It spreads those individual differences evenly. You're minimizing the chance that one group is just predisposed to better outcomes right from the start. It's like shuffling a deck of cards to make sure everyone has a fair chance.
Okay, that makes sense. But even then, I'm thinking, wouldn't people's expectations still play a role? Like, if they know they're getting this brand new drug, they might be more inclined to report feeling better even if they don't.
That's a great point, and that's where blinding comes in.
Ah, okay.
So ideally, in a double-blind study, neither the participants nor the researchers know who's getting the real treatment and who's getting the placebo. That's not revealed until the very end of the study.
So it's like a double layer of protection against bias.
Exactly. It helps make sure that any differences we see in the outcomes are truly due to the treatment and not just someone's expectations or preconceived notions about what's going to happen.
Okay. This is really fascinating. We're controlling for these variables, eliminating bias. It seems pretty impressive.
It is. And when done well, RCTs are super powerful tools.
Yeah.
They give us the most reliable evidence about whether a treatment truly works or not.
But I mean, even the gold standard, I imagine, must have its limitations, right? Nothing's perfect.
Nothing's perfect.
Yeah.
One big challenge with RCTs is that they can be very expensive and time-consuming. You need a lot of participants, you need to follow them for a while, and all of that requires resources.
Yeah, definitely. And what about ethical considerations? Are there ever situations where it might actually be unethical to do an RCT?
Absolutely. Like, for example, if there's already a proven effective treatment for a serious condition, it wouldn't be ethical to withhold that treatment from some participants by giving them a placebo.
Right.
It just wouldn't be right.
No, wouldn't. It's about finding that balance, right, between advancing scientific knowledge and also protecting the well-being of all those participants in the study.
Exactly. And sometimes it's just not even practical to do an RCT. Like if you're studying the effects of long-term exposure to something like air pollution, you can't really randomly assign people to live in polluted or non-polluted areas.
Yeah, you can't control where people live.
Exactly. So it sounds like it's not a one-size-fits-all approach with these study designs,
Yeah.
you know. There are definitely situations where other designs might be more appropriate or even necessary.
Yeah. It seems like there's a lot of nuance here. It's not just like one is good, one is bad. It really depends.
Precisely. Each design has its strengths and weaknesses, and researchers really have to think carefully about which design is the best fit for their specific research question and the context of their study.
This is really interesting. Are all RCTs like created equal? Are there different types or variations?
That's a great question. And yes, there are actually several different types of clinical trials, including different phases of RCTs. And each of these phases is designed to answer specific questions.
Phases, like levels in a video game or something.
In a way, think of it as a step-by-step process.
Okay.
So phase 1 trials, they're all about safety. Testing a new drug in a small group of healthy volunteers to see, what the dosage should be and if there are any side effects.
So it's like dipping your toes in the water before you jump in the pool.
Exactly. And then in phase 2, we start testing the drug in a larger group of people who actually have the condition we're targeting. This phase is about getting a preliminary sense of whether the drug actually works and if it's still safe for the intended population.
So we're starting to see if it lives up to its promise.
Exactly. And if things look good in phase 2, then we move on to the big leagues. Phase 3 trials.
Oh, okay. Those are the ones you hear about in the news.
You got it. Phase 3 trials involve a much larger group of participants, often thousands, and they're really designed to confirm the treatment's effectiveness, monitor side effects, and compare it to existing treatments or a placebo.
So it's like the ultimate test.
Pretty much. And if a drug passes muster in a phase 3 trial, it's often enough to get approval from regulatory agencies, like the FDA here in the US.
Wow, so this is a pretty long and rigorous process. But even after a drug gets approved and becomes available, the research doesn't stop there, right?
You're right. That's where phase 4 trials come in, also known as post-marketing surveillance.
So it's like keeping an eye on the drug once it's out in the real world.
Exactly. Phase 4 trials help us monitor long-term effects, identify any rare side effects that maybe didn't show up in those earlier trials, and see how the drug actually works in different populations.
It's really amazing to think about all these different stages of research involved in just getting a new treatment to patients. But all this talk of trials and interventions is making me think about, the ethical side of things.
Yeah, that's a crucial point. Ethical considerations are really at the heart of any research that involves humans, and clinical trials are no exception.
We touched on this briefly earlier, but I'd love to dive a bit deeper. What are the guiding principles that ensure that these trials are conducted ethically?
So the bedrock of ethical research really rests on 3 core principles: respect for persons, beneficence, and justice.
Okay, let's break those down a bit, starting with respect for persons. What does that mean in the context of clinical trials?
It means treating participants as autonomous individuals, capable of making their own informed decisions about whether or not they want to be in the study.
So it's about making sure participation is truly voluntary and that it's based on a clear understanding of both the risks and the benefits of participating in the study.
Exactly. Informed consent is absolutely key. Participants need to be given comprehensive information about the study, including its purpose, the procedures involved, any potential risks, and their right to withdraw from the study at any time without penalty.
It's about empowering individuals to make choices, right? About their own bodies and their own health.
Precisely. And for people who might be more vulnerable, like, say, children or individuals with cognitive impairments, even more safeguards are put in place to protect their rights and their well-being.
Okay, that makes sense. Now, what about beneficence? How does that principle apply to clinical trials?
Beneficence is all about maximizing benefits and minimizing risks for the study participants.
Okay.
It's about making sure that the potential benefits of the research outweigh any potential harm.
So it's like a balancing act, right?
Right.
Weighing the potential good that could come from the research against the potential risks to those who are participating.
Exactly. Researchers have a responsibility to design their studies in a way that minimizes those risks and to carefully monitor participants throughout the trial. If any serious or unexpected harm emerges, they need to be prepared to stop the trial.
So it's about constantly reassessing, right? Making sure everything's still okay.
Yes, and being responsive to any issues that come up.
Now, what about the principle of justice? How does that fit into the picture?
Justice is about fairness in selecting research participants, making sure that certain groups aren't unfairly excluded from participating or bearing a disproportionate share of the risks. It's also about ensuring that the benefits of research are distributed fairly.
So it's like striving for equity and inclusivity in the research process.
Absolutely. Historically, certain groups, like women and minorities, have been underrepresented in clinical trials. And this can create gaps in our knowledge about how treatments might affect different populations.
Right. So that lack of representation can lead to biased or incomplete knowledge.
Exactly. And the principle of justice compels researchers to strive for more representative and inclusive research that can benefit all members of society.
These ethical considerations are so crucial. It's really good to know that these principles are woven into the fabric of clinical trials.
Definitely. Ethical considerations aren't just an afterthought, they're an integral part of the entire research process. From the very beginning, from the initial study design, all the way to the data analysis and the sharing of the findings.
It really speaks to the commitment of the scientific community, right, to do research that's not only rigorous, but also ethically sound. And it also makes me think about those institutional review boards, the IRBs.
Yeah.
They play a role here too, right?
Absolutely. IRBs are independent committees that review proposed research studies, and they make sure that the studies meet ethical standards. They play a critical role in protecting vulnerable populations and upholding the integrity of the entire research process.
This has been a really great discussion about the ethical considerations that are so important for clinical trials. It's a good reminder that scientific progress, it should never come at the expense of human dignity and well-being.
Well said. Ethical considerations are not just a box to be checked. They're a fundamental aspect of doing research responsibly, shaping how we seek to advance knowledge and improve human health.
I love that. Now, after exploring all these different study designs, from simple case reports to those complex randomized controlled trials, and even thinking about the ethics involved, it makes me realize that choosing the right study design, well, that must be really crucial for getting reliable answers to those research questions.
You're absolutely right. It's like choosing the right tool for the job. You wouldn't use a hammer to tighten a screw, would you?
Not unless I wanted to make a big mess. So how do researchers figure out the best study design for their research question? What are the things they consider?
That's a fantastic question, and it's one we're going to delve into right after this.
All right, so we're back, and I'm really curious to unpack this question of how researchers actually choose the best study design for their research. It sounds like a pretty crucial step in the whole process.
Oh, it definitely is. It's kind of like choosing the right tool for the job. You wouldn't use a hammer to tighten a screw.
Definitely not unless I wanted to make a mess of things. So how do researchers decide? What are some of the things they consider when picking a study design?
Well, one of the first things they think about is the research question itself. Like, what are they actually trying to find out? Are they exploring a link between, say, a certain risk factor and a disease? Or are they testing how well a new treatment works? Or maybe they're trying to understand the experiences of people living with a specific health condition. It really varies.
So different questions call for different approaches.
Yeah.
Makes sense.
Yeah.
Can you give me some concrete examples? Like, how does this play out in the real world?
Sure. Let's say we want to understand the long-term health effects of something like childhood exposure to lead paint.
Okay, yeah.
A retrospective cohort study might be a good fit in that case.
Okay. Why a cohort study specifically?
Well, because we're looking at a long-term outcome, right?
Yeah.
We're talking about health effects that might not show up for years, maybe even decades. And a cohort study lets us follow a group of people over a long period. In this case, children exposed to different levels of lead paint, and we can track their health as they grow up.
So you could compare, for example, the rates of developmental problems or cognitive issues, maybe other health problems, between kids who are exposed to high levels of lead and those with lower exposures.
Exactly. And because we're looking back in time, we can gather data relatively quickly, even if the health effects we're interested in take a while to actually develop.
Oh, that's pretty clever. Now, what if we're looking at something more immediate? Like, let's say we want to know if a new type of surgical technique leads to faster recovery times compared to the standard technique.
Oh, in that case, a randomized controlled trial, an RCT, would probably be the best way to go.
Okay, and why an RCT in that situation?
Because we're testing the effectiveness of an intervention, right?
Yeah.
The new surgical technique.
Yeah.
And RCTs, remember, are designed to minimize bias and really isolate the true effect of that intervention.
Right, right. By randomly assigning patients to either get the new technique or the standard one, we can be more confident that any differences in recovery times are actually due to the surgical approach itself and not some other factor.
Exactly. And we can even take it a step further by blinding the patients and even the surgeons to who's receiving which technique. That's if it's ethically and practically possible, of course.
Makes sense. Those examples are really helpful. It seems like the research question really does guide the choice of design. Are there other factors that researchers have to consider as well?
Oh, absolutely. Resources are a big one. Large-scale studies like RCTs and those long-term cohort studies, they can be really, really expensive and time-consuming.
Yeah, I bet.
So if researchers don't have enough funding or they have a tight time frame, they might have to go with a different design. Maybe a smaller scale study or a study that uses data that's already been collected, like a case control study that analyzes medical records.
Oh, yeah. So it's about being practical and working with the constraints of what's available. Now, we've talked about ethical considerations in the context of clinical trials, but do those considerations play a role in choosing a study design more broadly?
Absolutely. Ethical considerations are super important in all research involving humans. No matter what the study design is, researchers always have to carefully weigh the potential risks and benefits to the participants, and they have to ensure that the study is designed and conducted ethically.
So if a study seems like it might pose a lot of risks to participants, or if it's going to be hard to get truly informed consent, the researchers might have to rethink the design or even decide not to do the study at all.
Exactly. Ethical considerations should always be the top priority, and they should never be sacrificed for the sake of knowledge.
That's really good to hear. It reminds me that science is all about bettering human lives, and that those ethical principles should always come first.
Couldn't agree more. It's a responsibility that all researchers share.
This has been a fantastic deep dive. We've learned about all sorts of different study designs, from simple case reports to those complex randomized controlled trials, and even about how to choose the right approach for a specific research question. I feel like I have a much better understanding of how health research actually works now.
And that's the goal. Understanding these principles empowers you to look at health information with a more critical eye. You can ask the right questions, and you can make more informed decisions about your own health. You're not just taking things at face value.
Exactly. It's about thinking critically, questioning things, and really looking for the evidence.
Yeah,
And it all starts with understanding these different research approaches.
well said.
This has been a truly fascinating look into the world of study designs. Thank you so much for joining us on this journey.
It's been my pleasure. And until next time, stay curious, keep learning, and don't be afraid to question what you see and hear.
We'll catch you on the next episode of Significant Talks.